Welcome, I'm Dr. Kingsley with Better Vet.
I'm Rachel, and this is my lovely assistant Turtle.
And this is Peter Quill, and today we're going to talk about the benefits of house call exams and house call medicine, some of the services that we can provide in a house call setting compared to more traditional ways of getting your pet seen and making sure they're as healthy as they can be. Step number one, benefits of an in-home exam. Rach, take it away.
Number one is obviously convenience. If you work from home, it's easy enough to have us come out. Avoiding the trip to the vet also reduces stress levels for your pets. So our real goal and benefit is to provide a less stressed vet visit to prolong the acceptance of future vet visits for your pet. And if the most recent new people your pet has met show up and give them pockets full of treats, we're winning for socialization all around with that pet.
Stress can also not just affect how your pet tolerates a physical exam, but it can actually cause physiologic changes. So some of the diagnostics that we see, particularly in cats that have been stressed out from a car ride, an unfamiliar space, unfamiliar smells associated with a more traditional route of getting a physical exam done, their blood work can actually show different markers of stress, and it could potentially skew what a normal blood panel should look like. So making sure these guys are relaxed and don't see us as a threat and see us as friends can actually give us way more information than we would see in a traditional setting. Now you're probably wondering, okay, well, we get why it's great. How do we prepare for an in-home visit?
The benefit of being mobile is that we are adaptable. If your dog is most comfortable in their bed in the corner by the fireplace, that's where we do the exam. For cats, if the carrier itself is stressful and is the worst part of seeing the vet, we ask that you just keep them in a nice small bathroom or a closet, someplace where they're comfortable, it's dark, and they're nice and settled, so that we start with more of a blank slate.
We don't want any additional stimulus that could potentially stress them out and then in turn associate that with our visit and exam.
Part of being fear-free is just pretending like we belong in the home. If you're of a mindset where you're just inviting new friends over for your pet to meet, we can get through at least half of an exam before they realize who we are.
Making sure that all of their favorite treats are stocked up and we have plenty to utilize as we're going through our exam and using our treat ladder, which is a unique form of practice where we actually will have different gradients or a whole buffet of treats to make sure that as we ask more and more from our patients, we have a way to pay them that they're receptive to. We're not throwing any Super Bowl parties or having any big events, and we want to try and keep everything as calm and quiet as possible. Those are some examples of how to prepare and make sure that when we walk in, we're going to have the most success and get the best experience for our pets, for our clients, and also be able to do the best medicine that we can. And now with our beautiful volunteer, we will show you what to expect and what an actual exam in a house call setting will look like. We'll go ahead and start by looking at her beautiful face and take a look at her eyes. So looking at her face, I'm looking for any ocular discharge or if there's any nasal discharge, skin around her face, no scabies. It can be an indication of a skin allergy. Looking at her teeth, we're looking for any tartar buildup, plaque buildup, any inflammation of the gums. Beautiful chompers. Even though that only took me about 30 seconds to get through, we get a ton of information. Next, we're gonna go ahead and take a peek in her ears. Not all animals like it, but it's super important. We wanna make sure there's no little infection or anything going on. I know, Mama, I know. So we just try to gently introduce the tool. You can tell she reacted a little bit the first time, but then when I just slowly came back, she was a little bit more accepting. And then we'll take a peek in this here. I know that one too. Goodness. Oh, I know. Okay. All right. So everything looks really good there. And we'll move on to feeling her lymph nodes. That could be an indication of any infection or potentially a cancerous process. I'm going to feel her thyroid gland. Thyroid disease is super common in cats. Back along, start to feel her joints, looking for any swelling or pain if she reacts. And so that'll do it for the first half of my exam. So now I'll take the business end and we will keep on proceeding.
And while she's got the important job, the fact that I'm keeping my hands on her the whole time is making her that much less reactive anytime Dr. Kingsley needs to put a hand on her. So it may look like I'm just hanging out and petting cats all day, but it is for a reason.
So now we're gonna take a quick listen to her heart. Everything sounds nice and steady. And then we'll listen up in her lungs. And then the other side. Oh, big sigh, big sigh. Everything sounds fantastic. No crackles or wheezes. That could be an indication that there's fluid in the lungs that shouldn't be there. So now we're gonna keep on moving down. I've palpated or felt down the big muscles along Turtle's spine. Everything feels nice and soft. There's no reaction. I felt her knees and her hips. Everything feels good there. Her muscles on each side are very symmetrical, meaning she's using all of her limbs normally. I'm looking at her skin, see if there's any inflammation or signs of fleas, which I don't see any. That is where we're gonna leave it with Turtle. And you can see we've gone through our full physical exam. You guys saw all of the information I was able to take from that, and we still have a very compliant, happy, purring patient. And now we're going to demonstrate what an in-home exam looks like on our canine friends with our handsome volunteer, Mr. Quill. One of the biggest keys that we have, hey buddy, is using treats to our advantage. This is both creating a positive experience for him, so the next time we do this exam, he'll hopefully remember the treats versus the weird instruments we're about to introduce him to. Utilizing the treat ladder, we can have them get on the scale on their own accord. We really want the animals to be comfortable, so it's really, really beneficial. I'm gonna pass this off to Rachel. I know, that's not the treat, that is. So while he's doing that, I'm gonna take a look in his eyes. Everything looks really good. Take a quick peek at the ears. I know, buddy, you're doing so good. So looking at our eyes and ears, making sure there's no ocular discharge, making sure the ears are clean, there's no stinky smell, no indication that we might have a little ear infection brewing. We're gonna feel his lymph nodes, make sure there's no enlargement there. And then we're gonna take a peek at his teeth, which actually have a little bit of tartar. We need to speak to Quill's dad about getting a dental here in the near future. So then I'm just moving my fingers right along, making sure there's no coughing as I put a little pressure on his trachea. We're gonna make sure his elbows are all solid. There's no swelling or enlargement. Same thing with the long bones, his wrists, his toes. Everything looks good. All right, buddy. So now we're gonna listen to his heart. All right, heart sounds good. And listen to our lungs. Everything is clear, normal. Again, we're gonna feel down the large muscles on each side of his spine, make sure there's no pain. So now I'm feeling his belly. Everything is soft. I don't feel any enlarged organs. He is not painful. We're gonna move down to his hips, and then we're just gonna stand him up really quick. Take a look under the tail. That all looks great too. And so with that, you can tell we still have a pretty happy kiddo and is probably going to be just as compliant the next time we come and do this exam. All of the different procedures that we can do include our typical recommended wellness items like vaccines, annual blood work, annual heartworm test, fecal testing, blood pressure readings. We can do fast scan ultrasounds looking for any kind of fluid. If we need to get a urine sample, we can use our small portable ultrasound machines. Blood draws, you know, if your cranky, very particular old cat has any kind of issues like renal disease or hyperthyroidism, we can come and do recheck lab work there where they're comfortable.
We have obvious limitations. We're not a hospital. We can't keep someone overnight. We can't monitor 24 hours a day. But when we remove that level of stress, we can move through an entire wellness exam, collect our samples, have more opportunity to run diagnostics that may be unavailable at your traditional clinic.
So hopefully this answers and clears up some of your questions, curiosities, concerns about house call practice. But if you have any more questions, post them down in the comments below.
We've also got lots of information posted there. And if you take a look and think, hey, maybe this is something that's going to benefit me and my pet, feel free to visit our website to schedule your in-home visit today.
Yeah.